provide for privacy, wash my hands. Hi Nance, my name is Kara. I'm going to be doing your pulmonary, cardiovascular, and abdominal assessment.
Okay.
And I'm just going to take a look at your skin here. I'm looking for any rashes, any lesions, hair distribution, feeling the temperature on both sides from proximal to distal, looking at the fingernails for any clubbing, none. Capillary refills in 2 seconds. Good. Looking at the posterior part of the back, and I'm looking for symmetry throughout, inspecting, and then I'm also going to palpate for any crepitus, and doing this throughout all the lung fields. Any pain at all? Any tenderness?
Nope.
Okay. And so then next I would percuss, and I'm checking for any resonance. And then I would do this throughout all the lung fields. And then I would auscultate, and I'll have you take a deep breath and exhale, and take a deep breath and exhale. And I'm comparing side to side. You don't have to take a deep breath anymore. I'm just going to pretend that each cycle I'm replacing the stethoscope. Listening for any crackles, any rails, any wheezing. Lower left, lower middle. And then I'm going to over to the front of the patient, and I'm going to inspect the neck vessels. I'm going to palpate the carotids. They are present. I'm looking for any heaves. I'm going to also listen. I'm going to auscultate for the carotid pulse. I'll have you take a deep breath. Hold it. 1, 2, exhale. Listening for any turbulence. That would be called a bruit. And I'm going to listen to the right side as well, and then I want to compare it. Okay. And then I'm going to palpate for any crepitus. Any fremitus would be, if you would say 99 in a deep voice, I would feel a vibration. And then I'm going to auscultate all the lung fields. Listening for wheezing, bronchi, rales. Okay, and then I'm going to listen for the 5 heart sounds. I'm going to listen. Second intercostal space on the right hand side is the aortic, and second intercostal space on the left is the pulmonic. Third on the left side would be Erb's point. Fourth would be tricuspid. Fifth would be mitral valve underneath the breast, and that would be at the apex of the heart. And then I'd listen with the bell of the stethoscope, aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And then I'll have you lie down here. And then what I'm doing is I'm going to be inspecting for symmetry. And I'm also looking at skin and hair distribution. I'm looking at the lower extremities here. I will be comparing temperature on both sides from proximal to distal. And then I would also be coming up here and checking for the radial pulses, which are present. The brachial pulses on both sides. Check for post-popliteal on both sides and compare them for quality and that they're present. And tibialis, and they're present, dorsalis pedis. And I'm also checking for any pretibial edema, which there is none, and I don't see any viscosities with that. And then I'm going to go and inspect the contour of the body. It is flat, and I am looking at the abdomen here. The umbilicus is right here. So here's my 4 quadrants here. I'm going to auscultate all 4 quadrants, starting with the lower right, and I listen to from 5 to 30 minutes if I don't hear a gurgle. You can also do it in a zigzag form. And then I'm going to percuss. And you should do, I'm looking for hyperresonance. That would be an abnormality. And then I'm going to palpate any tenderness here, feeling for the liver and the spleen and the kidneys. And I would do it lighter, and then I would do it deeper. And then I would also assess to feel the liver. I'd support underneath at the bottom of the ribs with my left hand, and then I would use my right hand on top and push down gently and take a breath. And then when she exhales, I should feel it kind of scoop into my hand. And on the right hand side, I would check the same similar way. I'd have my left hand on the place where the spleen would be, have a deep breath, and exhale. And then that would be, then I would describe to you the inguinal pulse, or the inguinal nodes, and that would be like right inside the underwear line. You want to feel for any bumps, any hardness, any masses. And the femoral pulse, you would feel right at the bottom near your pelvis here.
Okay.
And then what I would do is, to percuss for the CVA, I would look for the kidneys, and I shouldn't hear anything there. Okay. And that's the end of our abdominal assessment. For the breast exam, you want to do that once a month right before your cycle in the shower with your arm up over your head. And you want to feel gently, starting at the tail of Spence, working your way down in a circular motion, or you can go up and down. You feel lightly. And next time around, you feel a little bit deeper. You feel for any abnormalities, bumps, tenderness, and report that to your doctor. And for men, you'd do a testicular exam once a month, and you would use both of your hands supporting each scrotum. You would feel for sponginess in each testicle, for any masses. In between, there's a rope-like structure that's called the epididymis. That's normal, and you would report any abnormalities for that.
Okay.
That's the end.
Thank you.